right, so one of the things that patients have asked us often is about diet and nutrition and how to prepare for surgery, how to deal with diet after surgery. So we are so lucky to have Kari, who's the registered dietitian at St. John's. And so, Kari, just what is a registered dietitian and what is a nutritionist?
So the difference between a registered dietitian and a nutritionist is that a nutritionist, while they may have had some formal training, they really don't have any kind of certification or a certifying board, whereas registered dietitians have completed 4 years of education at a baccalaureate level, and then they have to complete a 1-year dietetic internship where we're doing supervised practice, learning about clinical nutrition, community nutrition, food service, so a real well-rounded background. And then we sit for a national certifying exam, and so then we're able to be called registered dietitians. We complete continuing education every year to kind of make sure we're staying up to date on all of the research and new developments, because nutrition is such a changing field every day.
It seems to be changing all the time. And so registered dietitians actually go through a formal course of study.
Yes.
And it's very different from physicians who usually get 1 to 2 classes during their entire medical career where we talk about nutrition. So it's a very basic level compared to your deep dive into micronutrients and macronutrients and health. Yeah, that's great. So that's why we're so glad to have Kari here as an expert. I wanted to talk a little bit about how patients should approach their diet prior to surgery, how to prepare themselves nutritionally for surgery.
I think it's best to make sure that you're taking a full picture of what you're eating throughout the day, making sure that you're incorporating a lot of fresh, unprocessed foods, fruits and vegetables, lean protein, whole grains, really preparing your body for this, traumatic experience of surgery, because it kind of puts your body through a shock. So we want to make sure that you're getting protein at every single meal, really focusing on the high quality proteins like those found in fish, like in poultry, like turkey or chicken, and then pork and beef more sparingly, just because they have more of the saturated fats in them. And then fruits and vegetables, because they have tons of micronutrients and phytochemicals that are going to help your body's cells function at their very best. So helping to speed up healing, helping to make you tolerate the anesthesia better. So all of those are going to be super important.
And why is protein so important? Everybody's talking about protein. Why is protein so important for surgery?
Protein's important because I like to say it's your building block of life. It forms the kind of basis of all your cells. So if you're not getting enough protein, that healing is going to be slower. It might not be as good. So we need to make sure we're getting adequate protein to help your healing process. All your cells need protein to kind of do the job that they're meant to do.
Okay. Now, in Los Angeles, so many of our patients are vegetarian or pescatarian or vegan. How should those patients manage their protein intake prior to surgery?
If you're like a pescatarian, you have a lot more options of things that you're going to get. So you can get fish, you can get shrimp, you can get scallops. There's a lot of good options. There's also a lot of great plant-based options for meat eaters, pescatarians, vegans. So I really encourage like soy, tofu, tempeh, edamame. Those are really great concentrated sources of protein. In the serving size of tofu, you get the same amount of protein as you would in like some ground sirloin or something like that. So pretty good amounts. Beans and lentils are a great source of protein, nuts and seeds, things like almonds, walnuts, pistachios, chia seed, flaxseed. So there's really no kind of excuse to say that you can't get protein. We can also supplement it with protein powders, but if you can get it from food, that's the best option.
So whole food, natural food is always better. But tell me, what protein supplement for somebody who can't take in all that protein, what supplement would you recommend?
So there are a lot of options at the markets now, so I like one of the brands of protein powder that has a good nutrient profile, is plant-based, would be like Vega. Another one is Garden of Life, and those are 2 more high quality. Whey protein is also well absorbed in the body, so that would be another great option. And you can get those at Whole Foods, at Ralph's, at CVS. So a lot of the protein powders are a lot more readily available at any market these days.
Yeah, we always encourage people to eat a healthy diet, but the reality is it is hard for many people on crazy schedules to eat a whole well-rounded diet. So we found that the protein supplements do a pretty good job of helping patients, and the people are picking these up at Costco, they're picking them up at Trader Joe's or on Amazon online, and so the protein supplements are very helpful. How would you help a patient distinguish between something like a plant-based protein versus a whey protein? Because when they walk into the store, there are 50 different types of cans. Which one should they just go there and pick?
So the first thing I always encourage people to look for is how much sugar is the protein powder going to give you, because often they'll put sugar, they'll put Splenda, they'll put all kinds of different things in there. So really you want to focus on one that's lower in sugar, because sugar can be very inflammatory, causing more inflammation in the body. So I always say check on the total carbohydrates, see how many carbohydrates you're getting, and also how much sugar you're getting. Ideally you want it probably less than 5. You don't want very much sugar in the protein. In terms of types of protein, I really recommend people to stay away from soy protein powders, just because it's a more processed form of soy. So we want to get more all natural soy in the diet. Whey protein is good. It's well tolerated. It's well absorbed. It's probably one of the better absorbed. And so I say get the concentrated whey versus, like, I think it's called the isolated.
So a concentrated whey without a lot of sugar, or some of the plant-based proteins.
Yep,
like
and
a pea protein.
Yep, pea protein, hemp protein. It really comes down for the plant-based ones, taste and preference, because some of them can have more of a gritty aftertaste. So I tend to say look for ones that maybe have some added omega-3 in them, or that have fiber in them, because I think a big part is like making sure your bowels are moving pretty normally.
Okay. So in preparing surgery, there are always 2 parts. One is adding on the right foods, the good foods, the supplements, the whole grains. The other part is starting to eliminate the bad foods. How do you counsel patients on eliminating, what should they be avoiding prior to surgery to get the best possible surgical outcome?
I would say start to limit alcohol in the diet, limit high sugar foods. So if you're going out, getting a milkshake at In-N-Out all the time, that might be something to kind of gradually cut back on. Anytime you eat out, like at fast food or even sit-down restaurants, it's going to be really high in salt, it's going to be really high in fat. So those are going to maybe, the salt will help make you retain more fluid. So we want to sort of decrease that. Also the high sugar intake. So any of those cookies, candies, sodas, especially regular soda, that'd be a big one to kind of cut back on.
And why are they bad for healing? Do they affect healing, or is it just that they just or make a person heavier?
So what the high carb, high sugar foods can do is they can raise your blood sugars. And so if your blood sugars are too high, if they're out of control, it's gonna impede your healing ability. So we really wanna help to normalize our blood sugar levels as much as possible, because if they're high, the high glucose kind of sort of backs things up and sort of puts you in a big traffic jam when it comes to healing.
Yeah, and the studies have shown that high levels of blood sugar inhibit wound healing, right? So I see it's important to start that process. Okay, so once you've added the good foods and you're starting to avoid the bad foods, the carbs and the sugar, how should a patient prepare his or her home for surgery?
I would say make sure you go on a grocery shopping trip right before, because when you come home you're going to have a lot going on, and probably grocery shopping is going to be low on the list. A lot of proteins, lean proteins, fish, chicken, they can all be frozen, so you just have to defrost them and prepare them. Fruits and vegetables, fresh or frozen is fine. Frozen I like if you buy frozen berries or frozen spinach, they're picked at their peak, so they're going to have a really high concentration of nutrients, and they're shelf stable. So if you're going to be gone for a few days, they'll still be there when you get back, full of good nutrients for the body. But making sure you stock up on shelf stable whole grains like brown rice, quinoa. If you buy bread, you can throw it in the freezer and pull it out when you get home so that it's ready to go. Fresh fruit should be okay if you keep it in the freezer. Vegetables I'd be a little bit more cautious with. If you bought, say, like lettuce or spinach, it may go bad, so it might be something to kind of buy frozen for that one.
Is the frozen okay afterwards? It's just as good, and it's
just
better than not having the vegetable.
Exactly. So it's rather being prepared, having the things you need so that you're ready to go when you get home.
And part of it is just managing logistics. So nowadays there are so many incredible services that will just deliver the food from Costco or from Ralph's or Vons. Have you seen one particular service that works well? I know there's a lot of patients have been talking about Instacart and how easy it is to use.
So I've actually used both Instacart and Amazon now, and I would say they're both equally probably beneficial. So if you have access to that, do the Instacart. You can kind of go, you have more variety of stores you can go to in your area, so that's what's nice about Instacart. Amazon now I think only has certain stores, but they both work well. I will say the shipping fee is cheaper on Instacart.
Yeah, and it's actually pretty simple. It gives you access to almost all the stuff at Costco, and just play with it ahead of time. Just try it, do a trial run, see how it works, and so that you'll never be short of food or healthy food after surgery.
Definitely, and Amazon, I think too, Amazon now or regular Amazon has a good variety of like shelf stable things or even fresh things that you can get delivered pretty quickly. So
okay, great. Well, thanks so much.
Yeah.
Okay.
You're welcome.